Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy channel. Today I'll be talking about Aphorisms 2 and 3 of the Organon of Medicine. You may recall that the final sixth edition of Dr. Hahnemann's Organon was not published until 1921, many years after he had originally completed his manuscript in 1842. Subsequent to that, there were numerous translations of the Organon into different languages by different parties. In this episode, I will be quoting from a 1952 Boricke and Taffel publication of the sixth edition of the Organon, translated by William Boricke, M.D. So let's jump right in. In this particular translation, Aphorism Number 2 reads as follows. The highest ideal of cure is rapid, gentle, and permanent restoration of the health, or removal and annihilation of the disease in its whole extent, in the shortest, most reliable, and most harmless way, on easily comprehensible principles. So in Aphorism 2, Dr. Hahnemann describes the highest ideal of medical treatment, which is to cure. The term cure here must not be taken lightly. The homeopathic version of a cure is meant completely differently than the way it's used in allopathic medicine. Hahnemann asserts that the curative process must be gentle and must be able to restore health. And it is not something that is just temporary. It's meant to be permanent. And this is quite different from the results that we have come to expect from allopathic therapeutic interventions. A homeopathic cure should not be unduly harsh and should not be accompanied by a laundry list of side effects that one must tolerate on an ongoing basis in order to benefit from the so-called cure. Of course, a genuine cure must also be able to end the vicious cycle of symptoms while restoring vitality and balance to mind, body, and vital force. Furthermore, a cure must be able to remove the entire disease in its whole extent, not just a symptom or a few symptoms. Technically speaking, there's no such thing as a whole person cure in allopathic medicine. Allopathic treatments are either palliative or suppressive, and they're always aimed at specific localized conditions or sets of symptoms. For example, even when a child's ear infection is, quote, cured by an antibiotic, this doesn't take into account the commonly observed fact that antibiotic treatment tends to weaken immunity and can render the child susceptible to subsequent ear infections or even other infections elsewhere in the body. The net effect, therefore, is often an overall weakening of the health of the child. Now, I know it can be interpreted as hair splitting, but I must admit that I've always had reservations about using the term cure, even in reference to homeopathy. To me, it implies absolute permanence, forever, as if to say that the patient got well and lived happily ever after and never became sick again, which is obviously an unrealistic claim to make. For example, if someone has regular attacks of gout every month or so, and then those attacks stop after homeopathic treatment, how can we be sure that they will never ever return again? Is it a cure after 1 year of no attacks? 5 years? How about 10 years? Technically speaking, we can never know for sure. So I don't like to use the term, especially in front of patients. Furthermore, it projects a false sense of confidence, an arrogant cockiness, if you will. And I don't think that it serves homeopathy's public image very well, if you know what I mean. Unfortunately, the term tends to be used on a regular basis in homeopathic circles. And I understand why, because there is no comparison between a so-called allopathic cure and a homeopathic cure. Nevertheless, I would much rather say to an inquiring patient that, well, we can't be certain, but it's as close to a cure as you can get. You may not agree with me, but that's okay. I prefer to err on the side of caution. Now, returning to Aphorism 2, Dr. Hahnemann states that a truly useful healing method must be based upon easily comprehensible principles. In other words, it must be based on principles that any dedicated and thoughtful student can grasp. After all, of what use is a system of healing if it can't be taught to others so that it may be transmitted over the course of time from generation to generation? In the next aphorism, we'll see the basic outlines of the comprehensible principles that Hahnemann refers to here. Now, whether a cure must take place rapidly is a debatable point. Rapid is an indefinite term that can mean different things to different people. The cure of many chronic diseases are not necessarily quick. Some require a sequence of remedies, lots of patience, adequate time for the healing process to unfold, and a willingness to allow the vital force to do its job. However, I assume that what Hahnemann really meant here is the fact that a correctly chosen remedy will work much more quickly than any pharmaceutical drug can. And I'm not sure that I like the word annihilation in this particular translation, because it bears too much of a resemblance to allopathic medicine and its war on disease approach to treatment. Rather than annihilate disease, it would be preferable to state that proper homeopathic treatment restores balance to the life force. On the other hand, if we take the term to mean complete elimination of the entire disease and all of its manifestations, then it becomes a little more acceptable to me. So, in summary, the ideal treatment should be gentle. It must be able to restore balance to the whole person. It must be able to reliably remove the illness in its entirety without causing harm, and the methodology that achieves this must be able to be taught to others in a clear, understandable manner. Okay, now allow me to read to you the text of Aphorism Number 3. Please bear with me, it's a bit of a mouthful. If the physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, parentheses, knowledge of disease, indication, if he clearly perceives what is curative in medicines, that is to say, in each individual medicine, parentheses, knowledge of medicinal powers, and if he knows how to adapt, according to clearly defined principles, what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue, to adapt it as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him, parentheses, choice of the remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of it required, parentheses, proper dose, and the proper period for repeating the dose. If finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judiciously and rationally, and he is a true practitioner of the healing art. Here in Aphorism 3, Dr. Hahnemann lays out the essentials of his new healing method in a nutshell. First, one must be able to perceive what is to be cured in diseases. Now, this is no small matter. We could fill countless volumes with discussions on this topic. As far as I'm concerned, it's ideal to be able to understand illness from both allopathic and homeopathic perspectives. The practitioner must have adequate knowledge of the various diseases and their presentations and progressions. In addition, one must be well versed in homeopathic theory in order to be able to identify what it is that needs to be addressed in the patient in order to bring about a proper cure. More specifically, one must be able to identify the homeopathic hierarchy of symptoms and the relative threat to overall well-being that they pose to the patient. One must also understand the relative value of various types of symptoms in order to be able to choose the most appropriate remedy. Lastly, one must be able to differentiate between the less important common symptoms and the more valuable individualizing symptoms. Now, in addition to knowledge of diseases and how they manifest differently in individual patients, one must also have a thorough understanding of the various medicines and their homeopathic indications. It's important to learn the general characteristics and symptomatic details of each individual remedy. And it's also important to be able to differentiate one remedy from other remedies in the materia medica. Finally, the physician must know how to match the most suitable medicinal substance with the unique symptom pattern of the case before him. When a remedy is chosen that mirrors the patient's overall condition with a high degree of certainty, then, as the aphorism states, recovery must ensue. The closer the match, the higher the probability of cure. Dr. Hahnemann then goes on to state that it is also important to understand how remedies are prepared, what doses are most suitable to treat a particular condition, and how often and at what intervals a dose must be repeated in order to achieve successful results. In the last part of Aphorism 3, Dr. Hahnemann makes reference to obstacles to cure. It's important to be able to identify factors that may be getting in the way of a successful cure. One must know how to take action or how to instruct the patient as to how to remove the impediment so that it will not interfere with achieving a positive outcome. This is why, for example, I tell all my patients that they should discontinue drinking coffee. I explain that in doing so, they will maximize their odds for achieving therapeutic success. To recap, according to Dr. Hahnemann, once a practitioner grasps these essential things, knowledge of disease and how it manifests uniquely in different individuals, knowledge of the remedies of the materia medica and how to differentiate them from each other, knowledge about how to closely match the symptom pattern of the remedy to the symptom pattern of the sick individual, knowledge of how to prepare medicines and how to administer them in proper doses at appropriate intervals, and knowledge of obstacles to cure and how to remove them, that is when he or she can be called a true practitioner of the healing art. All right, I hope you found this to be helpful. No doubt some will wish to quibble over some of the finer points made here, but that's okay. We're all just trying to understand the meaning of the instructions that this great physician left behind for us a long time ago. Thanks for watching. Be sure to subscribe and please share with your friends. And I hope you'll tune in again to the next episode of All Things Homeopathy. May the vital force be with you.